Now, what actually is alprazolam? Alprazolam is a therapeutic drug which is usually taken in through the oral route. It is present under the brand name of Xanax, but in Pakistan, you can find it under the brand name of Alp and Azolam. The next question is, what does it do? Well, alprazolam is a fast-acting tranquilizer with a medium duration. It is usually used for the short-term management of disorders such as the general anxiety disorder and the panic disorders. Think about the history. We have to go back to the 1950s to the end the 1960s. It was after the war that people were suffering from insomnia and post-traumatic stress disorder. So researchers started to find a way to combat this anxiety to reduce their stress, and it was when the first benzodiazepine drug known as Librium came into existence in 1955. Further development with the drug led to the creation of Valium in 1963, and after a few more years, when more and more research was done in the benzodiazepine classes, finally Xanax was made. The patent for Xanax was given to J.B. Hester of Upjohn Co., which is now affiliated with Pfizer. The patent was given in 1970 in Germany. Currently, alprazolam is a controlled for substance, which means that it has a low risk of dependence. And so now let's talk about the mechanism of action or the pharmacodynamics of alprazolam. So, like I said before, this drug can pass through the blood-brain barrier. So, what does it do? It goes to the GABA A receptors, the GABA type A receptors, and it binds to them to enhance their inhibitory effects on neurotransmission. And this enhancing of the inhibitory effects leads to the anti-anxiety property of these drugs. Now, the gamma type A receptor is composed of five subunits. It includes two alpha 1 subunits, two beta 2 subunits, and one gamma 2 subunit. And the benzodiazepine binding site is present between the alpha 1 and the gamma 2 subunit, where the alprazolam goes and binds and produces its effect. Studies in mice have shown that the alpha 1 subunit is responsible for the sedation and for the ataxic effect, and along with the relaxing effect of the alprazolam or the benzodiazepine in general, while the alpha 2 and alpha 3 receptors are responsible for the anxiolytic and the muscle relaxing effects. Now let's move towards some of the most exciting stuff, the pharmacokinetic properties. Now let's start with the absorption. Uh, Alprazolam has a very high absorption rate. It is absorbed rapidly through the GIT after it is taken through the oral route. It reaches max concentration in around 1.8 hours and has a bioavailability rate of 84 to 91%. But the important thing here is temporal dosing. If you give the dose at night, you might see a 30% increase in max concentration. Along with that, if you take a high fat meal up to 2 hours before the dose, you might also see a 25% increase. Next thing, regarding alprazolam, it's its volume of distribution. It has a volume of distribution of around 0.8 to 1.3 liters per kg in the body. And the important thing about this is it can also cross the blood-brain barrier, so it can go to your brain and cause its effects there. Next thing is how it's eliminated from the body. Most of the alprazolam is eliminated through the urine, and most of it is as an metabolized alprazolam, but less than 10% of the drug is eliminated in the form of alpha hydroxyalprazolam or 4-hydroxy alprazolam. The final thing regarding this is that it has a half-life of around 11.2 hours, but it can vary according to the condition of the patient and according to the age of the patient. And finally, we have the protein binding. Alprazolam is around 80% bound in the serum, and most of it is into the serum albumin. Now, let's talk about the clinical significance of alprazolam. What kind of people should use this drug? Well, according to its label, it should be used for either anxiety disorders or for panic disorders. But doctors have been using it off-label for other diseases such as insomnia, for premenstrual syndrome, and many other kind of disease. They are being used off-label as well. Now, you may ask, what kind of people should not use this medicine? Well, first of all, any person who has a hypersensitivity reaction to any kind of benzodiazepine class drug or alprazolam, well, he should avoid it entirely. Next, we have those people who have any kind of CNS or pulmonary disease, or they are using some kind of CNS depressants such as opioids. They might also want to avoid this. Why? Because it may lead to respiratory failure, low blood pressure, or may even cause death. Next, another contradiction is that you should uh, avoid using either CYP3A4 inhibitors or inducers while you're using this drug, because it might lead to an increase in the plasma concentration of alprazolam, or might cause a decrease in the concentration of alprazolam, both of which are not very useful to you and might even cause more harm than you might have before. And there are also some other medications which are contraindicated, which include some azole antifungals and cimetidine, along with some antidepressants such as fluoxetine. So you might also want to consult with your doctor regarding what drugs should you not use along with alprazolam. Now you may ask, what kind of side effects can I get with this drug? Well, first of all, you have the some smaller side effects which include shortness of breath, you have fatigue, tiredness, drowsiness, headaches, seizures, or even some kind of skin rashes. But the major side effects, first of all, is the dependence or abuse. Alprazolam has a history of being abused. So in patients, especially with those who have a history of drug abuse or alcohol abuse, they should be carefully watched if they're given this medication to make sure that they are not being addicted or they are not abusing this medicine. Next, we have the withdrawal symptoms. Alprazolam, if stopped abruptly, might cause serious withdrawal symptoms which will be very harmful to the patient. It may cause hallucinations, it may cause delusions, or even other kind of withdrawal symptoms. So what should we do? In such cases, we should not stop the drug abruptly. Rather, we should lower the drug dosage slowly day by day until a point is reached where the drug dose given to the patient is almost negligible. So we have to make sure that drug is not you stop abruptly, and we stop it slowly over time.